Yeah.
My name is Kim Hibbs. I'm the wife of Dr. Daniel Hibbs, and we live here in Nashville. I'm also a former RN, and I live with multiple sclerosis and chronic migraine disease. I have been actively pursuing efforts to provide safe access to medical cannabis for Tennessee's sick residents since 2008, when my own health crisis reached a quite severe and very painful chronic state. It is clear to me now that the science of medical cannabis is strong, convincing, and most of all scientifically rational. As a nurse, we are taught to find the rationale for everything that we do clinically and to use our medical knowledge base to always act first as a patient advocate. We are taught to make every other priority secondary to our patient's advocacy first. This principle is still taught in nursing schools across the country. In the 21 states and the District of Columbia where medical cannabis programs have been instituted, physicians and nurses are now allowed to do what they do best, treat patients holistically and act as patient advocates unrestricted by outdated, irrational, fear-based, and propagandized anti-marijuana laws that restrict the civil liberties of good, tax-paying citizens. Tennessee's physicians and nurses are not able to act fully on their patients' behalf, and they're limited to prescription drugs that often over-medicate patients in order to follow legal guidelines. Managing chronic pain is like walking a very tight rope, even when cannabis is used. Each person's pain and body chemistry is different. So being able to dose a little at a time with cannabis until, say, the pain or the spasticity ceases is really important. When I don't use the heavy narcotics that require anti-nausea medication in conjunction with the opiates that knock me out, I can dose just a little bit on an edible cannabis treat, or just take a couple of inhalations from a smoke-free vaporizer with cannabis concentrate. And I'm able to manage my pain much better than living exclusively on very dangerous and physically addictive narcotics, anti-nausea, anti-seizure, muscle relaxers, and strong anti-inflammatories and anti-seizure medication. When I use cannabis, I can cut all of those medications in half. Right now, my medication bag is a gallon-sized bag, and I can barely fit everything in there. I do this with my neurologist's support and his compassion. Shouldn't the goal of safe medical care be to keep us off of dangerous medications rather than blocking safe access to a much less harmful, God-given botanical medicine? The problem is that it's hard to find medical quality cannabis consistently or inexpensively, especially on the street or the black market, which is where you have to get it. A safe access program here in Tennessee will provide me the assurance that I can obtain cannabis in safety and that the cannabis I obtain will be consistently safe, effective, reliable, and affordable. It will also allow me to obtain relief without participating in criminal enterprise, and that's something that no sick person should ever be forced to do. It's time for us to be rational, scientific, and compassionate in the treatment of our sick citizens in Tennessee. If my neurologist feels that medical cannabis would reduce or alleviate my symptoms as well or is better than prescription drugs, he should not be so restricted as to not provide the best care that he or she possibly can. It is time for Tennessee to get smart. The facts are there. The data is there. To learn from the states that we have legalized medical cannabis before us, and to implement the best program we are capable of. The Safe Access Program will be authorized by the Cougar-Coon Act as just that program. Give patients and health professionals a voice and a choice again to pursue the safe option. Please. Those of us who obtain benefit from medical cannabis every day are tired of living like criminals living under the constant threat of arrest for use of a safe and effective natural medicine that does not run our livers, kidneys, hearts, and stomachs. Help us to step off of our legal and medical tightropes and give us safe access to medical cannabis options so that we are not forced to move to another state for our medical needs. And that's what's happening, folks. Do it for those among us who are suffering and for whom medical cannabis is proven relief. Don't continue to listen to the fearful anti-marijuana rants of the uninformed or those who benefit from perpetuating the senseless and unsuccessful prohibition of a natural plant. I hope I will get a chance to personally meet each and every one of you today or soon, and that you will give House Bill 1385 your most serious consideration and your most compassionate support. Help us to remove ourselves from the turmoil of the illegal marijuana market. Give us safe access to medical cannabis, and you will also give to us and our loved ones peace. Your vote in support of 1385 can move us forward into the future, and that will benefit us all through a tightly controlled but very patient-friendly medical cannabis safe access program. Do not hold us back for yet another year. With your compassion and determination to do the right, just, and educated thing, your votes can authorize this safe access program and make a real difference in the lives of so many seriously ill Tennessee citizens. Starting now, the time is now.
Thank you, Ken.